What have we offered the Pacific, Minister?
Thank you, Laura. So what we've offered is to work with our partners, including the United States, New Zealand, France, and indeed multilateral facilities to ensure there is full vaccine rollout in the Pacific. So when it comes to the compact states in the Northern Pacific, the United States is leading the charge on the rollout of that vaccine. And when it comes to what are known as realm states, with New Zealand, it's New Zealand, and French territories, it's the French. But in all other parts, in all other nations within the Pacific, we have reached out to them, and both through multilateral facilities, through COVAX, and through direct funding, we've pledged to ensure that those nations can have access to full vaccination for their populations in the coming months.
Okay,
so
what does reached out mean? Is this a formal offer? Are there numbers of vaccines that we have offered to these Pacific nations, or is it just kind of a general statement?
Well, no, there are two very specific measures that we've taken, along with other health and economic supports that have already been rolled out. But when it comes to vaccinations, we've got the COVAX facility, which is being done and coordinated in a multilateral way, and that will ensure around 20% coverage in the Pacific. And through our contribution, we believe it will deliver a 20% contribution to the vaccination of those nations.
Why in fact,
we anticipate. Well, if I can just finish,
Australia would do the heavy lifting in all of this.
Well, no, but if I could just finish, that's through the multilateral, and then the balance for those other nations that we're working with, we've undertaken to fund the balance so they can vaccinate their entire population. So we're working through those various facilities. So the multilateral COVAX will be available, we anticipate, in the next month or two. It's anticipated at the back end of March, perhaps. And then we're working through the process to ensure there are safe and effective vaccines rolled out right across the Pacific. So it's an absolute commitment from the government. We've written to those states and specifically outlined the specific assistance to each of those nations. It's a $200 million commitment across the Pacific and Timor-Leste, over and above the $80 million we're contributing to COVAX. So it is quite comprehensive, but what's really important is that we work with our partners, that we ensure that it's safe and effective, and that it's not just about the actual vaccines and the procurement of the vaccines, it's about how we ensure that those vaccines can be administered to those populations.
Yep, OK. On the numbers, we're going to get about 150 million doses of various vaccines. They're starting to arrive at the end of this month, and that assurance is given to Greg Hunt as late as yesterday. On the numbers, how many of those 150 million or so do you anticipate going to our Pacific neighbours?
Well, it remains to be seen, because obviously it would depend what surplus there is in Australia. But we've undertaken to ensure that the vaccines get to the Pacific. So that could be through surplus vaccines that Australia has procured. It will come through things like the COVAX facility, and it also will come through us assisting those nations through direct financial support and other support, and working through groups like the WHO to procure the necessary vaccines.
When you talk about surplus vaccine doses, does that mean that all Australians that want and need the vaccine will need to be vaccinated before that surplus then goes to the Pacific?
Well, that's going to be a matter for, obviously, the Health Minister as that's rolled out. But obviously our first priority is to make sure that Australians are vaccinated. So what our undertaking to the Pacific is to work with them, be it through surplus vaccines if they are available, be it through procurement, through multilateral bodies, be it through direct financial assistance, to ensure the procurement, to make sure that those Pacific nations have all of the access to the vaccines that they need. So if Australians are vaccinated and we have a surplus, of course that may well play a role, or it may come through other direct financial support. But we're working through those details nation by nation, because each nation has different requirements, has different challenges in its health system to distribute the vaccines, and so we're working very closely to understand those needs and to support those nations in making those decisions.
Well, China has reached out to at least the president of Micronesia, I assume other Pacific nations as well. They've offered to help vaccinate the population. Should they accept that offer?
Well, that's a matter for sovereign nations as to whether they accept or otherwise. What we would want to see, and I'm sure the leaders of each of our Pacific neighbours and Timor-Leste and other nations would want to see, is a safe and effective vaccine rollout. So you would want to be sure that it's been through proper testing processes, and as we work with our Pacific Island neighbours, we will ensure and we will work with them to make sure that WHO-approved bodies have tested these drugs and approved these drugs, because what we wouldn't want to see, I don't think there should be any lower standards when it comes to the vaccine rollout in the Pacific than what we'll have here in Australia.
China have the same standards as we do?
Well, WHO has its own standards, and so and it accredits certain bodies. So any vaccines that may come from anywhere would have to, for Australia to be supporting the procurement of them, would have to have gone through those WHO approved.
Are you concerned about China is using this as a way to exert more power, a bit of soft diplomacy in the Pacific?
Well, look, we're always looking at how things work in our region in the Pacific, and there are, of course, a lot of players in the Pacific, and China is of course, one of those. What we, of course, want in the end is for our Pacific neighbours and our whole region to have access to safe and effective vaccines. In the end, individual nations will make those judgments, and we respect their sovereignty. But what we're putting on the table and the processes we're going through, I think, will give them great confidence that not only do we have their back, not only will we give them all the support that they need, but we will go through really rigorous processes to make sure that when those vaccines are rolled out, they are safe.